Hi, good morning. After 21 years of being a dentist, I've kind of figured out that almost everybody that comes to the clinic has the same desire. So when a dentist asks the patient, "So what brings you here today?" It's kind of a redundant question. We have 32 teeth in our mouth, and there's a bunch on the bottom, a bunch on the top, and they work in between each other to chew. They help us with phonetics, they help support the TMJ, the most important element in our smile. And that means that there's 32 minimally potential problems that can happen in a patient's mouth. Now, when a patient comes to the clinic, the most probable thing that they want is to have a beautiful smile, to have healthy teeth, to have healthy gums, no infections, healthy bone, a good TMJ so that it can bite, no headaches. They want to have healthy gums, be able to brush their teeth comfortably, no bleeding, no pain. They want to have white teeth, not too white. They want to have a natural architecture to that. And of course, if you have the good fortune of having a natural smile that you were born with that was always great, none of this matters to you, and you probably just go for an oral hygiene. But for the millions and millions and millions of people around the world who don't have nice teeth, who've had bad dentistry or have had a lot of decay due to bad diets or just unfortunate accidents, getting their smile back is a really complicated and sometimes harrowing experience. So a patient will come to a dentist, and most times the dentist would say, "How can I help you?" And again, it's a redundant question. There's only one way you can help that patient, and that's by restoring their mouth entirely from a biological perspective, from a functional perspective, and from a cosmetic perspective. And the biggest challenges you will have are the patient's time. Maybe they just don't have time. They're very busy. They're a CEO. I don't know, their lifestyle just doesn't allow it. Or most probably the cost. I'm not going to get into the cost of dentistry because depending on where you are geographically, the price of your rent will change. So sometimes a dentist in the countryside is a bit cheaper than a dentist in the center of the city just because of the price of the rent. It has nothing to do with the quality of his dentistry. So dentistry is very indexed to the minimum wage of the country that you're in. I would say that the most important thing is the quality of your team, the science, the materials, the technology, the quality of your lab, and so on and so forth. But I'm not going to get into the cost of dentistry now. But I would say that building a brand new smile is kind of like building a house. And the biggest problem that we face today as dentists is the patient's firm belief that they can negotiate their way around your treatment plan. I don't see that happening, for example, if you go to an eye doctor, and let's say you need eye surgery in both your eyes, corrective LASIK eye surgery, and the doctor, the ophthalmologist, will give you a quote, and I don't see the patient saying, "Doctor, could you just operate 20% of my left eye, and we'll do the next in 6 months' time because I can't afford everything." Nobody would say that. I also don't see that happening with a heart surgeon. If the heart surgeon says, "You need to do a triple bypass," and the patient's saying, "Well, doctor, could you just do a single bypass or a double bypass?" I don't even know if that's possible, but trying to negotiate with the doctor their treatment plan and the treatment sequence because they can't afford the treatment. This is not science, it's not medicine, it's not what we're taught at university, but it's what happens every day in dentistry. So I like the metaphor that building a smile is like building a house. Nobody needs a window, nobody needs a door, nobody needs plumbing individually. What you need is the whole package. What you need is the comfort, the security, and the safety of a home. And in order to build that, you are going to need those infrastructures, you're going to need the wiring, you're going to need the plumbing, you're going to need the walls, the ceiling, and then of course you want to make it look nice as well. And that's kind of what it is when we build a brand new smile. We have to make sure that there's no infections, not just on one tooth, on all the teeth. We have to make sure the gums are healthy, not just one tooth, all the teeth, and there's 32 of them. We have to make sure the occlusion is good, that the vertical dimension is stable so that all your muscles and the TMJ is comfortable. That takes a lot of science and time, not just on one tooth, but on all of your teeth. We have to make sure your chewing capacity is good, not just on your left side, but on the right side, on both sides, at the back and at the front. And then we want to make your smile look nice. We want you to be able to feel comfortable when you look in the mirror. Not just one tooth, all your teeth. How many teeth can you see in a smile? Sometimes 20, 22, 26. Some people, depending on the elasticity of their facial muscles, you can almost see all the teeth. So it's really unfair that the patients try and negotiate their treatment with us when the end result, which is their happiness, depends on all the teeth being healthy, being functional, and being aesthetic. So I know there's a lot of people that are not dentists watching these videos. Just take that into consideration next time you negotiate your treatment plan with your dentist. Your dentist is not responsible for the problems that you have, but he is responsible for solving them and trying to keep you happy. So remember, building a beautiful smile is like building a beautiful home.